Bulagunaka, Namaste and good evening. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Tonight we are talking to the General Surgeon of the CWM Hospital, Dr. Timoci Qereqeretabua, and Principal Medical Officer at the National Diabetes Center, Dr. Momtaz Ahmed. Our issue tonight, we'll be talking about non-communicable diseases, but specifically focusing on diabetes, since diabetes has affected many people in this country. We know in our own family circles, we would know some friends or family members who have diabetes and how they may be dealing with diabetes. You may be concerned about it. You may want to do more in relation to providing assistance to them and making sure that your loved ones are taking the right steps going forward. So Straight Talk, for this one, we are looking at the issue of diabetes and how we can help you understand the issues better, how this is affecting our country, and with the amputation rates, other issues. We've had many deaths as well connected to diabetes, people losing their eyesight, and people badly affected by having kidney problems, needing dialysis, or even leading to death. So, gentlemen, thank you very much on behalf of our audience for accepting our invitation to appear on the show this week.
Thank you.
Now, starting with Dr. Qereqeretabua, what is NCD and some of the examples of NCD in Fiji?
NCD is defined as non-communicable diseases. These diseases that are not contagious or spread around easily, in simple terms. For example, COVID. COVID is not a NCD because it can be spread to other individuals. But NCDs is something that's acquired over time. It's due to lifestyle. It can be due to genetics. And an example we are talking about today is diabetes. You can have high blood pressures. Is another example of non-communicable diseases. So those diseases that are not easily spread from an individual, from one person to another.
Dr. Momtaz, definitely NCDs is a big concern in Fiji. You've been working in Fiji for about 5 years. Yes. How have you seen things progressively getting worse with more numbers coming in?
Yeah, NCD is actually a big concern here because NCD mainly due to the lifestyle. You know our people lifestyle very well. So the things is, it is not only in Fiji, even the worldwide NCD, 74% of worldwide death related to NCD. And in Fiji, 80% of our mortality is related to NCD. So this is a Fiji as well as global concern about the NCD. So now the best thing of NCD, we need to think about the prevention of NCD. And the other issue, you know, we have diabetes, major NCD, we have heart disease, one of the major NCD. Now cancer is among the NCD, cancer rate is also increasing. Also we included the mental health also, it comes under the NCD. So all this NCD, now it is a global concern as well as it is a concern in Fiji.
We're talking about diabetes, and we have different types of diabetes. Dr. Qereqeretabua, if you can shed some light on it for our audience, please.
The main two types of diabetes are type 1 or type 2. Most people have what we call type 2 diabetes. And the difference is type 1, normally younger people get it. It's what the children get is diabetes. When they diagnose children with diabetes, they normally have type 1. It's more of a disease that you can't fight or prevent when you have type 1 diabetes. It's just that your body cannot produce or is not responsive enough to the insulin that's been produced by the body. Unlike type 2, which is related to lifestyle modifications, exercise, diet and things, type 1 is more of an autoimmune disease. You can be born with it and you will have it. There's no major way to prevent it, such as like type 2 diabetes. So type 1 diabetes is less of a preventable type of diabetes compared to type 2, because it's in your autoimmune system rather than you acquiring it as a lifestyle as type 2 diabetes. So the types of diabetes is either your body is not producing enough insulin, as like type 1 diabetes, or your body is not responding well to the insulin, or is getting what we call resistant to the insulin, such as in type 2 diabetes.
Dr. Momtaz, we'll talk about what causes diabetes, because there's also a lot of people who love to say that we do not have this in our family. Diabetes is not in our family. It's a genetic disease, and then as highlighted by Dr. Qereqeretabua, then we've got the issues regarding type 2, which is a lifestyle related disease. If you can talk about that.
Let me comes from one by one. Actually, we have three major types of diabetes: type 1, type 2, and gestational diabetes. Diabetes during the first time of pregnancy. So type time, as Dr. Timoci already mentioned, type 1 is autoimmune disease. So it is not preventable. What happens, there is one cell in our organ, we say beta cell of pancreas that secretes the insulin. It is affected, but it is killed by the virus or bacteria or environmental factors. So the cell destroyed, no more secreting the insulin. So in type 1, there is absolute deficiency of insulin. Body does not produce any insulin. In terms of genetic not alone causing this. What genetic will do? Genetic triggers that autoimmune process to destroy the blood. This genetic is the trigger factor. That autoimmune process of the beta cell dysfunction, this genetic just triggers that process. In type 2, totally lifestyle disease. What we are eating, how we are living, our physical inactivity, our sedentary lifestyle, our obesity, overweight, excessive drinking, excessive eating sugary food, excessive drinking sugary drink. So all together it is the lifestyle. What genetic do? Genetic influence the process, genetic together with lifestyle, it influence the process of type 2 diabetes. Genetic alone cannot cause the type 2 diabetes. Type 2 diabetes mainly in the lifestyle.
So there you go. Dr. Ahmed has made it very clear that type 2 is a lifestyle related diabetes, and that people, you touched on drinking a lot of alcohol and sugary drinks. And that seems to be quite an issue now compared to maybe 20-25 years ago, with the amount of access to sugary drinks, including the alcohol ready to drinks, which contains a lot of sugar. If you can talk a bit more about that, Dr. Qereqeretabua.
I think in the last 10-20 years, our lifestyle, we notice every day in what we buy every day, what we eat every day, what we get our kids every day. It's changed dramatically. There are more kids, younger people having diabetes now. Our younger amputee was a 21-year-old young girl. So this tells us that it's pointing us to a direction where it's telling us that our lifestyle is changing so fast, and are we able to adapt to it in terms of making sure we read labels on the food shelf, all these little things that will tell us on what we are consuming every day. There is no doubt that lifestyle changes is a big cause of type 2 diabetes and caused the dramatic rise in diabetes in this country. they've estimated that 1 in 3 people in this country might be diabetic. So that's about 30% of the adult population. They're saying about 560,000 adult population, 80,000 might be diabetic. And by 2030, they said this will exponentially rise if we don't look after ourselves, we don't look after our lifestyles, we don't make changes in our primary health care. And yes, lifestyle and our diet has played a big role in this.
We're talking about symptoms now. How can people discover that they have signs of diabetes?
So this is three major symptoms. One is frequent passing of urine, number one. Frequent feeling thirsty. This is second symptom. And excessive feeling hunger. Feeling hunger, eat again and again after few hours, again feeling hunger. These three main symptoms. Apart from this, weight loss, blurring vision, feeling fatigue. This is the another, but three main symptoms. Apart from this, some patient may have weight loss, blurring vision, fatigue, weakness.
And you suggest that, how often do you suggest that people should get their sugar levels tested?
We always suggest those people, even they have not been suffering from diabetes, at least every 6 months. They should go to the nearest health center. Screening is free by the government. You not need to pay anything. Just go to the nearest health center or come to the diabetes center. We will test your blood sugar level.
Who are the high-risk group of in terms of diabetes, doctor?
Yes, we did research in CWM in 2017 around this, trying to stratify who are our high-risk individuals or patients who come in with complications of diabetes. And one thing we looked at, it's the eat okay men that came in the highest, with the highest rate of amputation, and those who didn't even know who were diabetic. So in this country, being eat okay, being male is a risk factor, and being obese, not doing enough exercises. And if you have a genetic predisposition, meaning if your parents were diabetic, there's a high chance you could be diabetic also. And these are the high-risk customers. Also women who got gestational diabetes, meaning they developed diabetes during pregnancy, they are a high-risk category of developing diabetes later on. So with these risk factors or people with high-risk categories, especially if they have an immediate relative or parents who are diabetic, these are the patients or the people who need to go to the health centers, to the diabetic hub, and just get a blood test. It's a quick, easy, few seconds blood test. And even the signs and symptoms we're talking about. Think, I'm changing glasses a bit, or you're feeling thirsty a lot, you're feeling hungry a lot, you're losing weight. Just go in, take a quick pre-con for the needle, and then you get your sugars ready. So it's readily available, but the public needs to be informed of these signs and symptoms. And I know there's a lot of people out there who have these signs and symptoms, but they do not go for help or seek help. And that's why a large number of patients who even come with complications didn't know they had diabetes until they developed complications of diabetes.
You talked about amputation in relation to a 21-year-old girl, and we will talk further about that. But the number of cases that you're seeing, definitely it's increasing based on the statistics we're getting. Yes. What are the youngest people coming in now and getting and discovering that they have diabetes?
Yes, so we've been seeing more. The median age for amputation in Fiji is around 55. So the highest rate for amputation is somewhere between 50 to 60 years of age. But now we are seeing more 30-year-olds coming in. We are seeing more 40-year-olds coming in, especially after the pandemic also. And this is worrisome because this is a big part of our working population that are coming in with diabetes undiagnosed until admission. Out of 3 amputations done, about 1 or 2 of them didn't even know they had diabetes until they came in with an infected foot needing aggressive surgical intervention. So we are looking at getting more numbers, but definitely we're seeing more and more younger people below the age of 50 coming in with diabetic related complications.
Warning signs there, Dr. Momtaz, in relation to people, younger people being diagnosed at the late stages, even needing amputation?
Actually, the things is, we have done one research, Dr. Timoci and I was the supervisor in CWM amputation. 7.5% amputation is newly diagnosed case. So the main one thing, the people, we have a screening facility everywhere, all the health center. People doesn't go to the house. We are campaigning, media, we are going to the community outreach. People doesn't go until they have complication. Then they look for the test and we found the patient having diabetes. A lot of patients, even from the oral health, they come for extraction of tooth. Then they are sending to us that the sugar is high because they are not going to the health center to check the screening. So our main objective to send the patient early to screen yourself and take, even if you catch a patient in the pre-diabetic stage, it is easily to prevent. No need medicine on the pre-diabetic stage. Easily to prevent, so it will also prevent the complication. But the thing is, here our amputation rate, because late presentation and people are not controlling their diabetes. Very relaxed, you know the lifestyle, how people behave. Behavior change is one of the most important thing here to control the diabetes, to prevent the complication.
Before we go to the break, we are talking about the issue people not coming in. And there's also a culture we were talking about earlier where people want to hide if they have certain diseases. Doctor, you would have definitely spoken to many people who may be shy about them having these kind of diseases.
Yes, even when we talk about the issue of diabetes and its complication, amputation with our colleagues overseas, other surgeons overseas, they're telling us maybe we're not doing enough awareness. And that's a good reason we're here this morning. But we keep asking ourselves why people are presenting late to hospital. So there's a lot of factors going on around here. So if you ask an individual, there's so many social factors. Some choose to go for herbal remedies. Some choose to go for other remedies outside of the medical hospital. And that kind of makes them present very late. When it becomes, for some families, when it becomes socially unacceptable, meaning the food has become so foul-smelling within the house, then they realize, oh, now it's time to go to the hospital. But one thing we've noted, and we keep telling patients, that diabetes, one thing it causes is neuropathy. Neuropathy meaning it disturbs the blood vessels, and what happens, it starts to kill the nerves around the foot. So one of the major complications is you lose the sensation of your foot. So for us, the Itoke society, for us, if we have something wrong, it has to be tender, it has to be painful. But in diabetes, you can have a full-blown abscess under your foot, you can have a rock stuck in it, you will never feel it. Your leg is numb the whole time. So a lot of people, they look at their foot and they say, no, it's not painful, it's not tender, there's nothing wrong with my foot. Although there's a high degree of sepsis ascending up the leg. So that's one thing I've noted within our Itoke individuals who come in. To them, it's like they say in the Itoke language, it's inimosi. And they think, no, it's all good. But we have to understand diabetes causes neuropathy, takes away all the sensation of your foot. So to you, it feels like nothing is going on, but there's something quite dangerous, like ascending infection brewing down there.
Don't you think that we've talked about awareness, that different strategies are now employed in terms of awareness, and the frequency of the campaigns need to increase to ensure that it's in all languages, and a direct message needs to spread across the country based on the increasing numbers?
I think we need to add another strategy like social marketing, that like the way business organization is doing. So those people who are not coming to the hospital, we need to go to their house. That's the because in spite of this, we are missing lot of people. Those who are not coming to the percentage of people coming for the checkup. So now we need to bring another strategy. We need to go to the house to check that, to do the screening.
Just to add on to that, and we thought geography might play a role in why people present late. And we noted in one of our latest studies here at CWM in 2017 that 70% of people who came in with delayed complications of diabetes or presented who needed an amputation, 70% of them live between Suba and Osori corridor.
So it's not geography.
So it's not geography. It's not geographical issues. This is changing the mindset of people, creating more awareness, and the culture we live in, the society we live in, with our traditional herbal remedies and all this other stuff that pulls them back and it just delays the necessary medical treatment that should have been done when the disease was quite mild.
We did get a lot of questions from the members of the public, and we are asking questions based on it's formatted within these questions. A lot of people are asking the question whether primary health care has failed in this country.
This country, with the resources we have, in a developing country like Fiji, I think the ministry is doing its best to tackle the issue of diabetes. I wouldn't call it a failure of primary health care. I think with the resources we have, with the manpower we have, but at the rate diabetes is, I think we just need to readjust, because in terms of primary health care level, meaning individuals alone themselves, as a society, we need to take care of ourselves. That's one big issue here. People are not finding themselves to the hospital. Awareness has been done. We got diabetic hub centers set up, but people still don't come in to get checked, to get seen for their complications, to get checked on time when their foot has a small ulcer. So the primary healthcare system is well established to look after diabetic patients in this country with the resources that we can provide.
I want to add, I don't think so. Primary health care, we are trying a lot. There is no failure in primary health care. Diabetes is the main is self-management. How we are managing our diabetes. Up to the, not only even primary health center, we have nursing station down to the primary health center. We have diabetes test facility up to the nursing station. People is not coming. We are telling them, we are doing awareness, everything. People knows everything. If they don't comply, what we can do? Can you force the people to do? We can't. So that's the main issue of non-compliance. That is the main reason for all complication and uncontrolled diabetes.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break.
I've always resorted to drugs because of the work that I do as a coping mechanism.
You said you started sex work and drugs at the same time?
I was 12 years old.
You believe, based on the current situation, your salary and allowances should be reviewed and reduced?
Definitely, I think it should be reviewed to reflect what is there in the market.
Is the government of the day promoting nepotism within our community and hatred towards Indo-Fijians?
Thank you very much. The answer is no.
$1 in $3 of our taxes goes towards servicing our debt. So you can't say it's nothing.
There's also the need to do financial inclusion a bit better.
What is your message to the people who may rate you as not good enough for finals rugby?
Success doesn't just happen overnight. Fiji Village Straight Talk with Vijay Narayan, brought to you by the Ministry of Health and Medical Services.
Empower yourself. Take control of your health. Breast cancer doesn't discriminate. It can affect anyone, from women to men. But early detection is our best defense. We encourage you to take the first step. Get informed. Get screened. Join the fight. Spread awareness. Together, we can conquer this disease. Schedule your checkup today. Your health is your power. A message from the Ministry of Health and Medical Services.
Welcome back. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight, Dr. Momtaz Ahmed and Dr. Timoci Qereqeretabua. We're talking about diabetes, and just before the break, we were talking about whether primary health care has failed, and a very stern message to everyone that there's free facilities available around the country, right up to the nursing stations at the diabetes hubs, where people can get free tests done to find out every 6 months what is your status. Now, what role does diet and exercise play in diabetes management, and what dietary recommendations do you commonly give to people?
Yeah, like in the line of work I do, we always make sure that patients get seen by a dietitian, especially when they're in the hospital setting, getting involved with an operation. But diet plays a very important role in our especially our starch, high carbohydrate diet, as we do in the Pacific Island. The high tapioca consumption, taro consumption, the rice consumption, and all. And you see our society. Most people are obese. They have high BMIs, and we can tell that in everyday living, in the way we eat, our portion of food is always it's a Pacific way of eating, and this definitely contributes to obesity, and obesity is a high risk factor for having diabetes, and diet is very important. Controlling it.
Vijay Narayan, I want to add, you know the statistics, about 38% people of Fiji overweight or obese. 38%. So, and this overweight, obesity. Another thing I want to include, if some people is thinking, if I am eating fat, I am not eating the sugary food, it may not cause diabetes. It is wrong. If your cholesterol level is high, there's one component in cholesterol, this we say triglyceride. If you eat plenty of fatty food, automatically your cholesterol, your triglyceride level will high. This obesity, overweight and high triglyceride level lead to the insulin resistance that cause type 2 diabetes. So that's the main. So people need to control their body weight as well. They need to eat less fatty diet. No, if the cholesterol level is high, develop the insulin resistance, and that lead to the type 2 diabetes.
So that's we'll talk about. We are currently talking about people who may have diabetes and they're coming late. There's another one, definitely people who are watching who do not have diabetes, and what would want to do the right thing would be interested in knowing to ensure that they do not add on to the statistics. Now, education on the current prevalence of diabetes in Fiji and how has it changed in the past 10, 20 years, if you can start down.
We've got what we call a multi-team approach to diabetes in this country now. So you have the teams at the diabetic hubs, you have the physiotherapists, you have the nutritionists, the dietitian. Now we have specialized doctors in diabetes who look after diabetes patients. And then you have the surgeons, and then you have the prosthetic unit that look after them post-operatively. So this is a multi-dimensional approach to a diabetic patient. It's just not a one doctor looking after a patient. And diabetes care is so important in that sense. For example, if I'm diagnosed with diabetes, where do I get my regular checkup? I go to the health center. If I have an ulcer, I go to the diabetic foot. And then you need to follow up your eyes. So we have the Eye Institute, the eye teams, the eye doctors that help all look after a patient who is diagnosed with diabetes. And in terms of prevention, we have teams, they go out for outreach. Dr. Momtaz can talk more on this. They go out to the periphery, they go out to the nursing stations to look at diabetes patients, to look at patients who've just had small ulcers, to prevent them having an amputations. So there's a lot of work at the primary healthcare level in terms of different teams working together to prevent complications of diabetes. For example, they make footwear for diabetic patients to stop them getting blisters or stresses around their feet that start an ulcer and leads to an amputation. So we got the physiotherapists, we got the nursing teams that have been trained to be podiatrists in this country, to help look after diabetic foods in this country, because diabetic food care is such an important aspect of prevention of complications of diabetes and amputations.
You talked about in the past decade or two how changes have occurred where more doctors are needed, more specialists are needed, definitely more cost involved now compared to maybe 20, 25 years ago.
Definitely. In the CWM department, where we look after most of all the diabetic foods that come through Central Eastern Division, about 40% of work involves diabetic patients. So you can see the cost. You can relate that with the cost of one patient being an inpatient every day, going for surgery, being admitted to ICU. This is more than $1,000 a day. So having a huge number of patients every day go through the process of being admitted, given antibiotics, given fluids, then the cost of taking them to theater, the cost of sick patients needing ICU care, this amounts to thousands and millions of dollars. And to take a patient into ICU almost costs more than $1,000 a day. So imagine the amount of people that are there at the moment needing medical treatment, needing surgical treatment every day, and the cost that it arises from looking after people with complications of diabetes.
Dr. Momtaz, we're talking about the prevalence of diabetes and how it has changed in the last 10, 20 years in Fiji. What is your assessment?
See, prevalence of diabetes, let's start a global concern. What happened? I will give you a global figure, then I'm coming to the Fiji. In International Diabetes Federation, when they published their data on 2014, the total world population 347 million people have been suffering from diabetes. In 2021, they published another data. From 2014 to 2021, October, they published 537 million people in the world have been suffering from diabetes. So from 2014 to 2021, see the almost 200 million population increase in diabetes. And they are predicting in 2045, it reach 743 million. This is their prediction. In Fiji, it is going, we have done one step survey in 2011, it shows 14.7% people having high blood sugar level. Now we are doing another step survey, the result yet to out. So when the result will up, definitely it will reach 15 to 17%. Huh? Huh? It will definitely increase. It will reach 15 to 17% prevalence rate in the new step survey.
And just commenting on that step survey, it was noted that our Indo-Fijian population there were more diabetics among them, but the rate of amputation is so much different compared to the Itoke population, who the prevalence of diabetes is less, but they have the higher rate of amputations. So that's why for the Itoke population out there, that we're in the way our mindset to diabetes and the way we're reacting to diabetes, something is not right. Yeah, we have a less prevalence of diabetes, but we still have the high rate of amputation. So this is one of our high-risk population that we are targeting, especially the young Fijian Itoke men.
Is it less prevalence, or they're not coming forward to get tested? We may have more in the community.
That could also be a factor. There are more people out there that are not coming to get tested, but this is with regards with Dr. Tukana and their research in the STEP survey a few years ago.
People are watching this show from different parts of the country and the world through live streaming, and they may be sitting down and thinking, okay, we have two doctors on the show. How can they help me if I want to take the right step to ensure I do not get caught up in this type 2 diabetes, which is a lifestyle disease, as it's been stated? What's your message to the people watching out there?
For the way I talk to patients is, one, not only look after physical health, stress. Stress is a big issue that we don't realize we have every day, and then we don't look after ourselves. We don't have the time to look after our feet. We don't have the time to go to the doctor to go get checked. And number 2 is diet. Diet is a very important factor. Exercise is a very important. If you're doing less than 3 times to go out and exercise a week, I think that's a bit less. You need to do more. And if you're diabetic, glycemic control, sugar control is very important to prevent the complications of diabetes. You can live a long, healthy, fruitful life with diabetes. People live 30, 40 years well, but it's just the way we don't manage our diet, our exercise, and above all, our glycemic control, and the little factors such as looking after your feet if you are non-diabetic. And to me, those are my pillars of advice: stress, looking after your diet, exercise, and your sugar control.
Dr. Momtaz?
We have specifically we say SNAPs, S-N-A-P-S. S for quit smoking. Those who are smoking, please quit smoking. Our diabetes center, one of the smoking cessation centers. If you come, we will assist you to quit smoking. N for nutrition. Eat healthy diet. Eat plenty of green vegetable. Consume less carbohydrate and less sugary food. Let me give you an example. Last year we went one of the village. We select a village that village people be physically active and eating what they are farming. We select that type of village we want to see. We just went for the screening down to the Vunindawa. 71 people came for screening. None of them has high blood sugar level, because all of them physically active and they are eating what they are farming. Even they are catching the fish, eating the fish from the river. So that's the things. So see the difference. Eating natural food, be physically active. In our Subanasuri corridor, we are eating more junk food. We are drinking more sugary drink. Our lifestyle is more sedentary, not physically be active. Just compare these two things. None of them is high blood sugar. We have almost every house has diabetic patient, our friend, our relative, or our family members. So that's for the nutrition. Third, limit the alcohol. We need to limit the alcohol. P4, physical activity. Be physically active. I always suggest 10,000 steps a day, just walk. 10,000 steps a day. Everybody has, most of people has the smartphone, just download that apps and whole day how many steps you walk, it will automatically counted there. And number 5 is stress management. We can prevent, we need to manage our stress. How we manage our stress? In the everybody lives, God give us this amount of good thing and this amount of negative thing. But what we people will do, when we think always negative one. We never think the positive one. That negative one increase our stress. And during stress, what happens? A hormone in our body, cortisol, secrete that increase the sugar level, that increase the pressure. So manage your stress by positive thinking. Always think positively. Manage your stress by prayer according to your religion. Manage your stress by exercise. Manage your stress by watching a movie, by singing song. Anyway, you can manage your stress. Be positive.
I have a question about that, because stress is an issue here in this country, and definitely mental health we've talked about. A lot of people dealing with everyday stress. The cost of living is going up and all these issues, and we are seeing a picture emerging. I remember a survey done more than 10 years ago showed they spoke to people who were coming to sell fresh produce in the markets, and they were buying after they sold fresh fish and all the vegetables, and it was in that survey it was reported they were going and buying canned food and noodles, etc., and taking it back when they were going back. What is your message to the people out there about that?
When I was working in the islands a few years ago, definitely I support what you said. Like the young man will come and sell me the fish to go and buy the tuna or the noodle at the shop. So we need to realize how important going back to just eating healthy food at home. As you can see, our parents, our grandparents, they lived long and healthy. They never had most of these diabetes and non-communicable diseases we have these days. And the message across is appreciate the things around you, appreciate the farm foods around the house, appreciate the healthy vegetables that you grow every day, instead of appreciating what is being bought at the shop. This mentality that things at the shop is better or much more nutritious is as we can tell, is all false. And we need just to look back at what our elders used to eat in the past and how they remain healthy and lived long and healthy.
Let's talk about appreciation. You talked about people focus on negative things a lot. Being grateful or being happy about what you have, and to make do with life. How can we do better in that area, knowing there's a lot of concern about how people are thinking of how they can provide for their family during these tough times?
See, we always encourage the people to utilize your land. Never think that I am an officer, why I should go for farm. You should never think like this. If you farm yourself, if you utilize your land by farming, you will get the fresh thing. You will eat that food. That's and also it gives you less stress because what you are eating, this is fresh. Second things, we need to do minimum, utilize the formula minimum resource, maximum utilization. We are not utilizing our resources fully. That's the another. Second things, just see, we are blessed to the government supplying medicine free, lab test free, treatment free. Those patient who has been suffering from the diabetes, please come to the doctor, get checkup done, take your medicines regularly, follow the advice of the doctor, follow the advice of the dietitian properly, so it will not prevent the further complication. How many country has free medicine supply? 20 country I went, either patient need to buy the medicine or insurance company pay for the medicine. I think only in Fiji government supplying everything free to the patient. So patient need to be careful. They need to take the ownership of their health. They need to be careful. Most of the patient missing the medication 2 to 3 days in a week.
We're talking, we will go back to Vunindawa, where you've got a success story there in relation to no one who got tested there had high blood sugar levels. Dr. Qereqeretabua, that's sort of a big highlight that we can focus on?
Definitely. No, I'm from the Highlands. I can see the change now in how younger people are living now with their younger families and what they are eating now compared to what people were eating many years ago, or what my parents used to eat. And now I'm starting to see, I'm from Narokroka, Wainmala, in the interior of Naitasiri, and now I'm seeing my own, some relatives who are coming, living in the village, who are coming in and being checked because they're diabetic. These are things we never used to see, or I never used to look after in my early years as a doctor. So we are already starting to see newly diagnosed diabetics coming out from the interior of Fiji, just because of the lifestyle change. Before, there was no electricity, so they didn't have a fridge. So now everyone has a fridge. Everyone is storing meat. The tide is changing. We've got fizzy drinks in the fridge now. So this problem will continue to escalate as people have more access to stores, to markets, and as lifestyle change, as I said, bringing in refrigerators, I think has changed the diet within a society for what I saw a few years ago. And now I'm seeing relatives coming in who have been living up there all their lives but are newly diagnosed diabetics. So doing awareness for them, and telling them how has this come about. It's all because of this modernization that we are not able to control ourselves in terms of the food we eat every day and the lifestyle change.
We talked about alcohol, and we know that there's a high consumption rate of alcohol in this country. You would have done surveys, and that the target group that has a lot of alcohol, and we can see the age group dropping for your amputations now to about 30-year-olds, 40-year-olds, youngest being a 21-year-old woman. Issue about the excessive drinking of alcohol amongst the young people, which also is increasing.
I do not have the numbers on that, but we can definitely say that definitely, yes, the rate of, we can see it in everyday society. We can see the amount of young teenagers or young people outside in the clubs at 1 a.m. in the morning. Alcohol does play a big role. We tend to be a society that don't drink every day. We'll have 2-3 beers every day. But what we'll do is we'll do a binge drink. This type of drinking habit we have in the islands. We won't drink the whole week, but when we do drink, maybe on a Saturday, it's more of a big binge drink up. And as Dr. Momtaz had informed us earlier that yes, alcohol does play a big role and increases the risk of diabetes in this country.
Dr. Momtaz?
Actually, you know that the things is, if I give you an example during COVID pandemic, when government give the allowance and all the supermarket out of stock alcohol, everybody rush to the alcohol. So that's the way you think that when people get the money, and especially young generation now, when they have money, they are very fond of alcohol. It is better long ago, but
alcohol was made cheaper. I believe the taxes in British were also reduced.
yes, so it is better. When we are a child, we are thinking, when we get the money, we are thinking buy a good football, buy a badminton racket, buy this thing is sports. But now the generation mind is changing, and instead of going that way, they are going the another way. So we always emphasize to go to the right part. If you get the money, go and buy the playing materials. You can play, you can do exercise. The only time people don't think negatively when they play. So the things is, it will fit the body, it will also refresh your mind, and it will also prevent the diabetes and other NCD. So another things, I always educate my patient: drink your coconut water rather than drink the sugary drink. Why you leave the coconut water or going to the sugary drink? And that increase the rate of diabetes here. Coconut water is $2, and why you are buying the drink on $5? Drink your coconat water. That's the best thing for the Fiji.
Healthiest drink in the world with the highest level of electrolytes, and
Yes.
it comes quite easily for us. We'll go to a break. We'll be back after this.
Did you know cervical cancer is the second most common cancer among women in Fiji? But what is cervical cancer? And how do you know you have it? Cervical cancer is the growth of abnormal cells in the lining of the cervix. Nearly all cervical cancers are caused by HPV, a virus that can be spread through skin-to-skin contact of the genital area. Women in their 40s are at high risk of getting cervical cancer. Head to your nearest screening facility to get a pap test and make a difference to your health today. A message from the Ministry of Health and Medical Services.
Get ready to elevate your event with Total Event Company's top-notch gear hire services. From a stunning 12 by 12 meter adjustable stage and impressive 13 by 13 meter production roof, we've got your event covered. Our gear can fit any venue, big or small. Need tents? We offer 3 by 3 meter pagodas, 6 by 3 meter tents, and a grand 15 by 30 meter marquee tent. Turn your vision into reality. Choose Total Event Company for gear that makes your event shine. Visit the Total Event Company Facebook page or dial 3314766 to get in touch with us.
Welcome back. You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We're talking about diabetes tonight. A lot of discussion happening about how you can prevent it from happening, how you can look after it, and the need for you to visit your closest health center and the importance of doing that. Let's talk about physical activity. The government is having a discussion at the moment. We had the Minister for Youth and Sports here trying to get the youth to have development centers in different parts of the country. He did say having a gym in a neighborhood or in a village or in a province alleviates a few things. One, that the youth get involved in physical activity. He gave an example of a gym set up in Kandavu, which has resulted in them having a rugby team. But what are some of the aspects where we can have some positive development that can be actually tangible, and you can see the benefits when you look at increasing NCDs and how you can tackle it?
It's a good question, because if you look between Suva and Nausori corridor, almost half of the population of Fiji is living between this corridor. And from leaving Suva, going past 3 miles all the way to Nausori, you can see the limited amount of parks we have. You can see you don't have much recreational areas parks for kids to go and play every day because of the building of new houses and all of these things. So I think that is one thing we should look into, creating more recreational areas around this long corridor, because this corridor houses thousands and thousands of people, and you can see young people are being squashed up into small playing fields. You can count with one hand how many parks there are for children that are being well looked after. And this is one aspect that I think we should try and consider. Living in a highly high populated area now is how we create recreational facilities that they are free, that are readily available for people to use every day in a very, very busy corridor, such as from Suba to Nosore.
Dr. Momtaz, the importance of investing in things that will prevent such diseases, like facilities like parks, gyms, etc.
See, this is the things I agree with Dr. Timoci too. We need plenty of field where our children will go for play. This is not for sport, this is investing your health. If you create more place for the physical activity, this is just investing our health. If people are doing exercise, all our people, the burden of the NCD will reduce. The economic burden of the country to controlling this disease also reduce. So how much we spend, if we spend $1 in sports, we will get benefit of $10.
Great way to put it, and definitely we'll be speaking to the Ministry of Health, Ministry of Education, and Ministry of Youth and Sports, and even Deputy Prime Ministers and Prime Minister about the issue. We're also talking about labeling of food. We talked about making sure you're checking them, but also an assessment, a proper assessment. People are calling for assessments to be made on who is checking the food labeling to ensure we actually have those actual ingredients which the company or the wholesaler is claiming is in that product. Dr. Momtaz.
Actually, we should need to check the food, all the food, imported food. What is labeling there, either the things is inside or not. So actually, we have only one laboratory for food testing in USB. Actually, this is the only one in USB. We have a food testing facility. So actually, it is the NFNC and other food organization responsible to check the food, but they are trying to check. They are checking it, but I don't know. Actually, I don't have any data. But whenever we sit for the meeting, we always inform them to test, to check those food. What is in the label? Is it there inside or not?
Warning bells ringing, no doubt, Doc.
Yes, and even if we are checking, but how do we, another part I think we need to look into is training diabetics, training the public on how to read food labels, or what are the labels that will ring bells for them that I should not be eating this, or this is too much carbohydrate in this. So not only will we be able to, we should be checking food coming in, but how ourselves as a society, as an individual, how do we enlighten people? How do we make awareness on what are the labels you're supposed to be reading? What are the right quantity of things you're supposed to be looking at? It'd be very different to put the right food on the shelves, but for an individual alone to be trained, I think which will be for a diabetic to go there and read the label every day and see, okay, this is the right amount of carbohydrate I need to take every day. There will be another aspect we need to look into. Training patients, training people how to read food labels properly and calculating the calories or the requirements that are on those labels.
Are you planning to do any campaigns on how to read food labels properly?
Actually, we have not done any campaign, but Diabetes Fiji take one initiative. So they will certify, still is on process, that they will certified, they will give some of the food. They they give the marking, okay, this food you can take, this food is, you can. So this is their ongoing process, but I don't think so they have started. But this several times we discuss about it with Diabetes Fiji, and Diabetes Fiji is taking that initiative to certify the food that is beneficial for the diabetes patient.
For developed countries who have more resources to put into diabetes, it's very different from restricted resource countries such as developing nations such as Fiji. They branched out into these little things, like even teaching them how to cook food as a diabetic. If you become diagnosed as diabetic, they take you for cooking classes. They take you for classes to read on how to read labels. But as we progress on, as our healthcare system widens and our multidisciplinary approach of diabetes starts to grow, all these things that Diabetes Fiji is looking into is all part of the plan in trying to deal with diabetes.
I had the head of athletic performance of the Swai-shipping Fijian Drua and Flying Fijians lead strength and conditioning coach Nadha Imbuka on the show last week, and he also raised the issue about going right to the education system, and from primary to secondary having proper physical education classes, ensuring that it also has knowledge sharing based on nutrition, etc. What are your thoughts on that?
Definitely agree that this needs to be done. This needs to start at the grassroots level. This needs to start with children. We need to change the way children themselves think. Start looking at fizzy drinks, or this is not good for me. It's all to do with mindset, and starting at a very early age, taking into schools to nurture our children and make them aware at a very early age that some things or these food products is not good for them is the right way to go about it. And there are children these days who get taught these things and they start to follow it. They're just not kids, they can think on their own, and the children can choose between a fizzy drink and water these days. And I think that's a brilliant way to start it off, and going down to that level, primary school education, and educating our young ones about the balances needed to prevent non-communicable diseases.
Dr. Momtaz, what are your thoughts on that? Maybe we need a review of that curriculum?
Yeah. We are trying to, several times in the meeting we discussed that we want to include NCD in the school's health curriculum. So the student, our students should have primary knowledge about what is NCD, what is diabetes, how to prevent it. So this is ongoing process. Second thing, our school health team, we have a school health team. They are also going to the school and teaching the student what the good food for them, what is the healthy food, how to prevent the disease. All the primary education they are giving to the student.
Let's talk about amputation rate in Fiji. We've talked a lot about it. It's been in the news. Compared to maybe 20 years ago, Dr. Qereqeretabua, where do we sit?
So amputation rates has, in the last 2 decades, has increased. Back in 2017, we were doing amputation rates at about 8.5 every 8.5 hours. Back in 2010, we were doing about an amputation every 12 hours. So you can see the number has increased, the amputation rate has increased also. And these numbers will continue to increase if we don't deal with the issues regarding primary health care, diabetic food care, glycemic control, and our numbers are staggering. We have one of the highest amputation rates in the world, according to the International Diabetes Federation. One of the highest for a small country like Fiji to be listed up there as having one of the highest amputation rates in the world is quite astounding. And this will continue to rise if we don't sort out the issue of as you said, at a grassroots level, meaning if we don't, our awareness, our primary health, changing patients' mindsets if they have diabetes, how to look after themselves, how to do their exercises, control their diet, control their stress, and controlling their sugars. We are always looking at the end spectrum of the complications of diabetes as a surgeon, but these numbers will continue to rise if we don't sort out the early prevention aspects.
Your rate is one amputation every
8.5 hours.
That was done based on the assessment.
Based on assessment.
What year was
that was in 2017.
Do you think it's increased further?
Definitely, we're doing more work on getting more numbers out there, but definitely after the pandemic, it'll be quite interesting to look at our numbers now, especially after COVID. I think definitely COVID has played an impact, and COVID would result in more patients coming, not coming on time to hospitals. And I'm sure that number would have risen a bit more, especially after COVID.
Let's talk about diabetes. Also is causing a lot of other issues. We see dialysis hubs opening up in different parts of the country. A lot of people now dying of kidney failure, kidney diseases as well, apart from diabetes, which is connected. If you can talk about that, Dr. Momtaz.
Actually, it is the uncontrolled diabetes that cause the which is a nephropathy. So that cause the chronic kidney disease. So those people, those patients who are controlling their diabetes regularly. Control means everyday control. Today control and tomorrow is high. Another day is high. Went to the party and sugar is too high. The next day again no. So when we will do the average blood sugar level HbA1c, it indicates the average sugar for the last 2 to 3 months. Definitely it is high. That means your diabetes is not controlled. So we say the control means everyday control. So those people who is controlling, no complication. Those who are coming for the CKD, chronic kidney disease, that lead to the kidney failure and that need dialysis or a kidney transplant.
Which for some people is too late because in terms of financial capability becomes a very big issue for the family.
Becomes a burden. And most people who come for amputation complications already have some degree of renal impairment.
Which is a kidney
failure.
Your kidney functionality.
Some already function at only 50%, 40%. They haven't completely failed, but there's already a degree of damage to their kidneys by the time they come into hospital. And this is one thing we see because diabetes is what we call a silent killer. A lot of people out there listening today, some might look at them, no, I don't have it, I don't need to get checked. But it's a silent killer because you can have those who have been diagnosed with diabetes have had it for several years before they finally been diagnosed with diabetes. So it's away slowly at your eyes, your feet, increases rates of heart disease, kidney failure. A lot of patients come walking around now have some form of renal impairment. They wouldn't even know at this time.
The issue about, you had talked about starchy foods. You talked about Pacific way of eating. What's the message from both of you about starchy food?
Actually, we always emphasize on healthy eating. Healthy eating means eat half of the plate will be green vegetable. Only 1/4, that is 30%. Remaining half divide into 2. 20% is protein. And 30% of the plate will be you take carbohydrate. Carbohydrates, we are not telling you not to take carbohydrate at all because carbohydrate that build from the energy in the body. So it should be 30% of your plate. This is more than a bit 1/4 of the plate.
Not a mountain.
Not mountain, but what you see here, the full of plate will be carbohydrate. That's the things is starches food that lead to the high blood sugar level and diabetes that lead to the obesity. So that's the thing, the portion of the plate need to maintain. Ensure your half of the plate will be green vegetable. 30%, that is 1/4, a bit more than the 1/4 of the plate is your carbohydrate, starchy food, and remaining 20%, that is a bit less than 1/4 of the plate, will be protein.
Dr. Qereqeretabua, people are watching also. What's your message to you? Refer to the Pacific way of eating.
We got one is portion. I mean, as he said, but now volume also comes into play. You know, these are basic things. It's hard to change our diet, but as we said, you know, obesity and is a big risk factor to developing diabetes. You don't see anyone with 120 kilos at 80 years of age or 90 years of age, because it's only the slim, the low BMI, these people, the individuals who survive longer than the obese individuals. And diet is a big part of our lives. We just need to control it. And my advice to the public, we got nutritionists, we got dietitians out there in the primary care system, in the main hospitals, who can guide you on how to portion your food, who will guide you on calorie intakes, who are well educated on this, and normally we will refer you to them to have a good session with them, which is quite important in the way we eat every day.
Artificial sweetness. Some people say I use artificial sweetness and that should be fine.
We don't recommend actually artificial sweetener at all, because what is it? It is a fructose. Ultimately, fructose in the body digestion convert to the glucose. So we don't recommend artificial sweeteners.
I would agree with Bunai.
Now, you have talked about services, you've talked about a lot is available, you talked about amputation rates, the death rate also increasing amongst the young people. This is a real concern. Young families, maybe some children yet to come out of primary school, losing their fathers and mothers. What's your message to them, and what's the death rate?
I would like to emphasize this morning that every surgery done in a hospital has a reason. We have tick boxes that you feel that this gentleman or this woman needs an operation. And it's unfortunate that by the time most of our diabetics come in, they already are in the category we can salvage their leg. They already need an amputation to preserve life. That is what is important for us, because a 40-year-old can lose his leg, but he can go on a prosthesis, he can go a walking frame, he can even drive again, and he'll be there to support his family. But it's unfortunate that most of our patients come late. We don't even need to think twice that they need an amputation, because they are so sick when they come in. And the younger people, as we're seeing more younger people, yes, it's painful for us to see younger people lose their legs. It's a very serious decision for someone to agree to losing a limb. And we support them, we counsel them, but at the end of the day, whatever is dead needs to be put away so that we can preserve life. Because there's still more work to be done. The kids need to be looked after. Taxi driver can go back into taxi driving, and we try and encourage them, and we tell them this is not the end. You know, we've got rehabilitation centers available. We've got physiotherapists that will get you back on your feet. And if you taxi drive, you drive an automatic vehicle, you can. And even with just a prosthetic foot. There's a gentleman whom go to the gym sometimes with his in his 60s. I never knew. You look at him, you never know he has a prosthesis. He's walking around, doing weights, living life normally. So for many people out there, especially for the young people, we tell them having an amputation is not the end, but it will do more harm if the sepsis ascends, and harms you. But changing the mindset then and there to have the amputation to preserve life is a very important aspect of our duties, and encouraging them there's still life after this, after rehabilitation and after good prosthesis.
Dr. Momtaz, the death rate, including kidney problems, etc., and what's your message to the people out there who are watching this, the importance of getting things right for their own lifestyle?
I have three messages. Number one, prevent diabetes. Type 2 diabetes is totally preventable. Number two, those who have been suffering from diabetes, control your diabetes properly, so there will be no complication. We have some patient, 80 years old, after 30 years have been suffering from diabetes without any complication. Because controlling, every day checking their sugar and taking their medication, maintaining their diabetic diet, no any complication. So if you control your diabetes properly, no complication come, it will prevent the premature death. Our means premature death means death before the age of 70 years. And this is happening here because of uncontrolled diabetes lead to the complication, then lead to the death.
Yes. And in terms of mortality, once you have an amputation, your chance of mortality in the next 2 to 5 years rises also. So having an amputation increases your risk of mortality. So in the first 2 to 3 years after an amputation, it rises to about 30%. But by 5 years, we've seen that those who've had a previous amputation, 80% of them don't live for more than 5 years.
The risk increases.
The risk increases after having.
Just before we finish off, the death rate is known at the moment, or do we need to get latest statistics or survey done?
It is Dr. Timoci, CWM, they are calculating the actually.
That will have to come back on the numbers on total death rate caused by diabetes in this country. But we all know that non-communicable diseases is the biggest kill in the world. It's about 80% of deaths is lead to non-communicable diseases. But exact numbers here in Fiji, whether it's post-surgery, outside of surgery, out in the periphery,
we know 80% of the deaths in Fiji are related to NCDs. So that is a number in itself. And we have one of the highest rates of amputation in the world.
As per International Diabetic Federation.
And what about the diabetes rates compared to the rest of the world?
Diabetes prevalence is also high in Pacific country as well as in Fiji, but we are just waiting for the step survey report. Then the one is ongoing, so then we will see. We have the previous report, so we are waiting for the new.
Compared to other countries, big countries in the world, yes, they have the highest number of diabetes. But in terms of complications for amputation rates around the world, our numbers are up there. We might not have the highest number of diabetes, but we do have the highest, one of the highest rates of amputation.
And it continues to rise.
It continues to rise.
That's the show for tonight. We'd like to thank Dr. Timoci Qereqeretabua and Dr. Momtaz Ahmed to take out their time coming out from their surgeries and also their appointments and to come and talk to us. We're grateful for that. And we will continue to discuss this going into next year as well, to ensure that we're looking at more preventative measures to ensure that we make a difference for the better for the people of this country. And that's what this show is about. It's about having those impactful messages coming through and to ensure that change continues for the better of the people of Fiji. Until next week, have a great evening.